everybody. So I wanted to finish the conversation about mental health and the stigma surrounding that. As I'm watching and waiting for my daughters to get out of their cheerleading practice at high school, as summer's getting to the end and school starting, I started thinking about, why do we have this stigma? And I don't know if I don't have an answer for it, so I'm just going to preface it with that. But I started thinking about, what are the stigmas that we see as nurses in schools with mental health? And I think probably what I see the most prevalent is the concept that these kids are just lazy. They don't want to go to school. You'll hear comments like, well, if they just, could kind of get it together, or I don't know why their families don't just take them to the doctor. Or I hear things like, well, it's just because the kiddo won't take their medicine, or their parents are coddling them. Or I hear things like, well, it's just, mainly because they want attention and it's not really a real mental health diagnosis. And things like that. And I'm sure you can all come up with a handful more. But I'm wondering, where did that start? As a nurse, I have to believe that we get into this profession because we care about kids, we care about patients. And I know that we don't intentionally try to have a bias or to, not give patients or students the benefit of the doubt, right? But the reality is those are comments that I hear often. It's not like just a one-off. And started thinking about, like, how can we push back, but respectfully, professionally, gently, to where we're meeting the kids where they are. Because at the end of the day, it's up to us meeting them and the families where they are. And you know what? If the story is embellished, okay, but it's not my place, right? My place is to be supportive, empathetic, compassionate, and just offer resources. I feel like a lot of it comes from, like, society as a whole, where, back in the day, I'm in my 50s, so I'm imagining back when I was in high school, mental health wasn't really called out. It just wasn't. People had it, maybe, I guess, but it wasn't even talked about, right? And so it wasn't even part of our conversation. And I feel like today we do a better job as a group, recognizing, calling out, talking about it. But I think that there's still like that kind of like behind the scenes discussions. And I would love that to stop, because I feel like that puts such a hard pressure on our students, especially especially when I see in my LGBTQ groups where they don't want to talk about it, right? And if you look at the data, it is as clear as day that they have such a high prevalence of mental health and depression and anxiety. And I think that we need to not add to it, right? Like, we need to help it. And so I feel like we just really need to talk about this and have a really good discussion and make sure that we're all on the same page about how can we be loving